Welcome to the 2026 Medicare update. I am Erin Ackenheil and I'm excited to bring this for you today. Let me go ahead and add my presentation to the stage here. So let's talk through this right now. So it's important every year to stay abreast about everything that's happened with Medicare. So I've kind of put this presentation together to keep you updated and apprised to all the things that are changing for next year. The philosophy and experience of Blackpoint is all about education. So we have our YouTube channel. I encourage everybody, open your phone, go onto your camera, take a picture of this QR code, and you'll go right onto my YouTube page. Please subscribe, please interact with the content. You'll see this presentation that we're doing here, the 2026 Medicare update. You'll find companion videos like the income-related reconsideration video for next year. It's also a great place to see everything from how to get prior authorization on a medication to what to do when you travel. So please open with the QR code here and get educated. Working with a broker in general means multiple carriers, multiple plans. We work everywhere across the country. We want to keep you abreast of everything, keep you up to date on plan changes. And a great way to do that is by subscribing to our YouTube. So please help us, support us, interact with the content, ask a question, really help us grow. Today's agenda is pretty straightforward. We're going to talk about the A, B, C's, and D's of Medicare for 2026. I'm going to talk about the differences in the plan types, Part C Medicare Advantage versus original Medicare paired with the Medigap or Medicare Supplement, otherwise known as a Plan G for grade or Plan F, paired with Part D. All the changes to the standard design for prescription drug coverage for this year, impacts on your plans, and any next steps. So first up, let's address Medicare Part A. Now, Part A is the first part of original Medicare, Part A and B. When you have A and B, you have a red, white, and blue Medicare card. It says Part A, hospital, and an effective date, and Part B, medical, and an effective date. Part A is known as the hospital portion of Medicare, and that's exactly what it covers. It covers room and board in the hospital. It covers skilled nursing facility care or rehab care, and it covers people who need hospice for terminally ill. Fortunately for most people, they don't pay again for Medicare Part A because we pay for it while we're working. We pay in 10 years or 40 quarters into the Medicare line item out of our paychecks. We've already paid for Medicare A, so we typically don't pay again. Now, if you were married to someone for at least 10 years and you did not work outside the home, it's possible you could get premium-free Medicare Part A through your marriage. Now, Medicare Part A, when you go to use it for inpatient hospitalization or skilled nursing, there are costs associated with it. The biggest cost associated with Medicare Part A is the inpatient hospitalization first minute deductible. For next year, the first minute deductible under Medicare Part A for inpatient hospitalization, it's going up to $1,736. That's the first minute in the hospital for your room and board. And by room and board, they mean your room, your TV, the meals, the nursing care. That's all going to be Medicare Part A. Physician services like a doctor, an anesthesiologist, or a surgeon, that's going to be addressed under your Medicare Part B benefits, but your room and board are A. After the deductible is met, the first 60 days in the hospital is covered at no charge for your room and board after the 1736, keeping in mind that there could be additional services for physician care. Now, if you're released from the hospital and readmitted within 60 days, fortunately, you don't have to pay the $1,736 again. However, anytime you've been released from the hospital more than 60 days, a new deductible or benefit period will begin. This is one of the big reasons that having additional coverage like an Advantage plan or a supplement makes so much sense to so many people. Now, if you had a lengthy hospital stay, which believe it or not, sometimes people do, beginning day 60 through 90, you would actually have a daily coinsurance in addition to the $1,736 deductible. And in 2026, that's $434 per day under original Medicare A. Again, really easy to get insurance that covers this gap. If you had to be in the hospital more than 90 days in a row under original Medicare, you would go into your lifetime reserve days under the Medicare program. You have 60 of those, and the cost per day would be $868 per day for that benefit. If you go above 150 days in the hospital, you actually have to pay full price for your room and board. Skilled nursing facility care is typically transitional between hospital and home. Maybe someone had a hip replacement or a stroke. they may not be ready for home. In 2026, when you go to a skilled nursing facility, the first 20 days continue to be covered 100% under original Medicare for skilled services. If it goes above 20 days, days 21 through 100 have a daily copay going up in 2026 to $217 per day. Hospice care, which is comfort care for terminally ill patients, continues to be covered 100% by original Medicare. Keep in mind that Medicare is designed around skilled services and comfort care, not room and board. So typically room and board or long-term care are a completely separate type of insurance. Medicare Part B is the second half to original Medicare. And to get a Part C Medicare Advantage plan or to use a Medigap like a Plan G or a Plan F, you're going to need Medicare Part B in place. A and B, the full pair of original Medicare. Now, Part B typically has a premium for most people. Some people are eligible for a state program that may cover their Part B premiums. If you're low income and you're paying for Part B and you want to look into that, you can look at our companion video on how to eliminate your Part B premium for low income. For others, they pay more than the standard premium because they're assessed something called IRMA, or income-related monthly adjustment amount. And that's when Medicare looks at your 2024 income to determine your 2026 premiums, and they say your income was too high to pay the standard amount. If that happens, sometimes people pay more than the standard premium of next year of $202.90 per person per month for their Medicare Part B as in boy premiums. We do have a companion video about IRMA and also how to get premiums reconsidered if your income situation has changed since calendar year 2024. The vast majority of us are going to pay the standard premium for next year, and that is jumping up from $185 to $202.90 per person per month for 2026. If you're drawing Social Security benefits, Medicare is going to take the new premium, the $202.90, out beginning in January. If you don't draw Social Security benefits, Medicare typically is going to bill you quarterly for the $202.90 times 3. It's important to have and maintain your Part B benefits to get any additional coverage that's going to work under the full Medicare program. Part B is super important, and the reason the insurance companies require it to be on a Part C Medicare Advantage plan or to make your Medicare supplement or GAP plan work is that it covers about 80% of physician services under Part B. Physician services are anything from a doctor's visit to a specialist, emergency room, ambulance, expensive treatment like MRI, CT scan, ambulance. All of that is going to fall under Medicare Part B. And so Medicare covers 80% of that under the Part B program, which is super helpful. The problem for you is that you have to pay 20% of it, and there's no ceiling on how high the costs go. So imagine a major surgeon's $50,000, paying 20% of that would add up in a hurry with no max out-of-pocket ceiling on your costs. This is one of the key reasons why people get additional coverage, like a Part C Advantage plan, or they go original Medicare with a GAP plan and drug coverage. The other thing under the original Medicare program is that you may have to pay excess charges. This is what happens when you see Medicare providers that take Medicare but don't take assignment or Medicare's reduced rates. They're allowed to balance bill up to 115% of what Medicare allows. Again, you don't see that on a Medicare Advantage plan. On a Medigap plan like a Plan G or F, it covers the excess charges, so you don't have to worry about it. Now, Part B has always had a deductible hanging out in the background. They change it every calendar year. In 2026, it's going up from $257 and $25 to $283. A deductible means you have to pay this before the Part B coverage is going to kick in. So for instance, you go in to have a specialist visit, the first $283 is out of your pocket. Once it's been met one time, then you continue to be covered by the original Medicare program 80/20, or coverage is included in your supplemental depending on what you choose. Now, keep in mind that Part B does not cover prescription drugs outpatient, right? So the ones that you would pick up that you take on an ongoing basis, that's not going to be covered under Medicare Part B. You're going to need to get a standalone drug plan, or you'll get your drug coverage through an Advantage plan to get it as part of the Medicare program. Dental is not typically covered by Medicare Part B, so your cleanings and your x-ray and your dentures, it's not a Part B covered benefit. Routine eye exams and glasses, not covered by Part B. Routine hearing exams and hearing aids, also not included. Some people are surprised to find that Medicare does not cover routine physicals, head-to-toe routine physicals, but Medicare does cover Medicare wellness exams, a new to Medicare wellness exam within the first 12 months of Part B, and then annually after that. So it's important to understand the terminology and how things are being covered under the Medicare program. It's also important to note that original Medicare A and B typically does not include foreign travel. So if you go to Europe or you go to Mexico, you're going to be on your own for coverage if you have an urgent or emergency situation. And that's where having additional coverage like a Part C Advantage or a Medigap plan can help cover some of those costs for you. So a lot of people ask me, either I'm on Part C and it's been going well, is this still right for me? Or I'm on a Medicare Original with a Medicare supplement and a drug plan. What's Part C all about? Is there an opportunity for me to save money? And Part C Medicare Advantage is simply a new way for some people, or an existing way for others, to get their Medicare benefits, their A and B. When you join a Part C Medicare Advantage, you're essentially assigning your original Medicare A and B over to a private insurance company. No matter where you are in the country, that's how these plans work. You have to keep paying your Medicare Part B premium no matter what, but your benefits have been assigned over to this Advantage private insurance company, and you'll use that card for all of your benefits, doctors, specialists, prescriptions, and so forth. That plan is getting money for each person who enrolls in the program directly from Medicare. Your premiums play a role, but it's more than just the premiums you pay. It's also based on the average cost of care in the area and other risk factors based on your health and coding of your conditions by your plan. So Medicare pays these private insurance companies money every month to have you be a part of their plan. These plans usually use a network, either an HMO or PPO, and they're always regionally based. So what's available in San Francisco, California is different than what's in New York City or in Kentucky. It's going to be different in every state, every county, based on where you live. So just because you see something advertised on TV does not mean that plan is available there. The cool thing about Advantage plans is they do embed everything in one program. So you typically get your A and B original Medicare, you get your prescription drug coverage, and lots of enhancements all in one umbrella. Sometimes they're going to add things like dental, vision, and hearing, which, as you know, original Medicare normally doesn't cover. They also often will cover routine physicals on an annual basis, which Medicare doesn't cover, and many of them enhance foreign travel benefits as part of their program. There are typically copays per service, and there's always a max out-of-pocket ceiling on what you'll pay. Some of them are very low, and some of them can be higher. So that's something you need to look at individually when you consider this plan option. Some key takeaways on Part C Medicare Advantage plan is, remember, you're not using your Medicare card when you're on a plan like this, but you are continuing to pay your Medicare premiums. When you enroll in an Advantage plan, you agree just to use that private insurance company's card, and you agree to follow their rules. Their rules typically mean a network. If it's an HMO, it's going to require you to choose a primary care physician or main doctor, and to see a specialist, you're going to need to get a referral from the primary care doctor before you go. If it's a PPO, you have ability to see anyone in their network and self-refer to specialists, but if you go out of network, you're going to share in the higher costs and a higher max out-of-pocket ceiling. So a network component is always a factor in Medicare Advantage plans. So if you're considering them or you're a part of one, you want to make sure the providers of care that you want to see are part of the network. That's not limited to just your primary care doctor and specialist. That could be a mental health provider. It could be your physical therapist. It could be the lab you want to go to. So the flexibility could be important to you. An Advantage plan could be something that may or may not work depending on who your providers are. The cool thing about Advantage plans is that they typically have low or no monthly premium. So again, you're paying your Medicare Part B. You keep paying that all along, but oftentimes the money that the carriers receive directly from Medicare for your care is enough that they can provide many additional benefits, including prescriptions and extras and bonus features and low copays, all for no additional cost or a very low monthly premium. The other really nice thing about Medicare Advantage plans is they frequently include Part D. The Medicare Part D program is embedded as part of the Advantage plan, and you get your drug coverage all part of that one card or that one plan. The other thing that I've noticed is about the Part C Medicare Advantage plans, they often enhance Medicare's standard design for drug benefits. Frequently, they waive or reduce the Part D deductible. They often have very affordable copays, and a lot of times people are averaging lower costs on a Medicare Advantage plans as compared to a standalone drug plan. Every situation is different based on your needs and the medications you take, but generally speaking, Medicare Advantage can reduce your cost sharing on prescription drugs. The other nice thing about Medicare Advantage plans is they publish in advance predictable copays or coinsurances for each service. Now, this is something you want to evaluate if you're considering Advantage plans, if you're okay with the copays that you would pay. So a certain dollar amount to see a doctor, certain for specialists, there can be coinsurance for certain services. You want to make sure you review the full, what they call summary of benefits, to see how those plans are going to cover certain services that you may need. The nice thing about Advantage plans is they always have something called a MOOP, another acronym that stands for maximum out of pocket. There's always a ceiling. So unlike original Medicare, right, where there's no ceiling on that 20% coinsurance, here there's always a ceiling on what you'll pay on Medicare Advantage. So it's some good protection for you in the event that you need something serious. Now, the big annual election period for Part C Medicare Advantage plans and Part D drug plans runs every year from October 15th to December 7th. This is the time where absolutely everyone on Medicare with A and B is eligible to enroll in any Part D drug plan or Part C Medicare Advantage plan that's in their service area for a January 1st effective date. We just passed this period for this year. It happens every single year. If this is something you want to look at, we can gather your information sooner versus later and look at that for next year. There also can be several special enrollment periods throughout the year to join Part C or Part D. Maybe you're new to Medicare. Maybe you've had a situation where you have one plan and you want to try to switch to another one. There can be alternative timeframes where you can enroll in Part C Medicare Advantage or Part D. But the most common is the annual election period, which runs every year, October 15th to December 7th. If you have questions about the election period, you can ask just by emailing us or putting it in the comments, and we can give you more information on the election periods. Is this type of program going to be right for you? It really varies based on the person. If the doctors you see and the providers of care that you want to access are available as part of the network and it covers your prescriptions well, you can provide that to us. The names, the dosage, the quantity, the frequency, even the preferred drugstore can make a difference in terms of which Advantage plans will work for you. Has your providers and your prescriptions and you're okay getting referrals and staying within a network unless it's urgent or emergency, this can be a great option for many people. It can really reduce your costs and give you a lot of bonus features that you don't necessarily get under original Medicare. For some of you who are saying, nope, that's not what I chose. I like original Medicare and I like something called Medigap. Other names for Medigap include Medicare Supplement. You might hear it as Plan G for great or Plan F for fantastic. The hallmark to this kind of plan is you have original Medicare, your red, white, and blue card as your primary insurance, and your Medigap or Medicare Supplement or your G is your secondary insurance. On this plan, the great thing is that you can go anywhere you want that Medicare is accepted with your red, white, and blue card and your supplement or Medigap card, and you have access to those providers. You don't need to get a referral to see a specialist. Now, the providers have to still agree to see you, but referrals are not officially required by the plan, and it's very, very flexible in terms of getting the benefits. However, Part D is always purchased as a separate policy, so you have to buy a standalone drug plan, and that's an additional expense for you. Dental, vision, and hearing are also a la carte, right? If you want those services, you have to pay extra. And then the Medigap or Medicare Supplement plan itself has a monthly premium that can go up as you age or goes up with inflation depending upon where you live. Acceptance into a Medicare supplement or a Medigap like a G or an F is not always guaranteed. When you're new to Medicare, you have a 6-month window. There are other exceptions throughout the year, occasionally, depending on changes to your current coverage, could potentially get you into a Medicare and a supplement. And some states have guaranteed acceptance year-round. For others, they don't have that guaranteed acceptance, and you may have to go through medical underwriting. That's a fancy name for health questions. And based on your answers, plans may or may not take you into that type of program. So you have to be careful if this is the type of plan that you want, that you're sure to secure it when you have a guaranteed acceptance. The great thing about Medicare supplement plans is when you use it paired with your red, white, and blue Medicare card, it's usually very low out-of-pocket costs when you use it for Medicare covered benefits. Unfortunately, if Medicare doesn't pay for something, neither does the Medigap plan. So that's something you got to keep in mind. The hallmark to these plans is access to the full Medicare network. So if you want to see a doctor at a private facility, or you see specialists in an alternate county, or you're the type of person who says, I've researched and this is the only provider that does a certain type of treatment and they take Medicare, you get access to that when you use Medicare Red, White, and Blue as your primary and a Medigap as your secondary. If having that full access and not getting referrals is really important to you, Medicare and Medicare supplement might be the right option for your situation. The downside is the premiums. They are much more expensive than the Advantage plans. And they usually go up as you age. So depending on where you live, they can be age-related increases. Some plans or areas have what's called community rating, where 65-year-olds and 99-year-olds pay the same. But consequently, that usually means the overall premiums are higher and can still go up due to inflation. So it can be a lot more expensive to have a Medicare supplement plan, and the costs continue to rise as we get older and as inflation increases. Part D is a separate policy. To get a Part D plan, you have to buy it as a separate standalone drug plan. And some of those are low cost, but some of them are well over $100 a month. And that's on top of what you're paying for your Medicare and your supplemental. So it can get quite costly because all of the benefits, essentially, when you go original Medicare and a Medigap, are a la carte. Standalone drug coverage, standalone vision plan, standalone dental plan. Everything is an additional cost or service. Now, the upside to Medicare and a supplemental is there's very low cost sharing. For instance, if you're on a plan F like Fantastic, which means your A, B, or both began before 2020, if that's the case, you're literally covered 100% for Medicare covered benefits. No deductibles, no coinsurance, no excess charges. If you're Medicare A, B, or both were after 2020 and you're on a Medigap plan, you're probably on plan G for great. That's going to cover everything but the $283 Part B deductible. So if Medicare covers it, so does your gap plan, and your only gap could be that Part B deductible on that plan G. Now, there can be other gaps depending on the Medicare supplement plan that you choose, but typically the coverage is very comprehensive, and for Medicare covered benefits, you're covered very, very well. The downside, if it's not a Medicare covered benefit, you usually have to pay under 100% or buy additional coverage. Enrollment periods are not set for Medigap or Medicare supplement plans. Usually in most states, you're going to have to go through medical underwriting or health questions if you want one, unless you're lucky enough to live in a guaranteed issue state where you can get it without health questions. If you live in one of those states, the premiums are typically even higher, though, for this type of combination of plans. When you're new to Medicare, absolutely everybody has a 6-month window from their Part B eligibility to enroll in Medigap without delay or underwriting. So that's really, really important. Is this combination of plans right for you, or does it continue to be right for you? If you're already on a Medicare supplement plan and you value the flexibility and you can afford the premiums, this probably continues to be the right option for you, even though you have to buy your additional benefits a la carte. You can remain with your existing supplement plan each year and still reevaluate your drug plan between October 15th and December 7th to make changes for the next year. Typically, this combination of plans works best for people who really value the flexibility of self-directing their care, and they want very low out-of-pocket costs when they use it, keeping in mind that if Medicare doesn't cover a benefit, neither does the Medigap plan. They're going to deny it as well unless it's specifically designated. For instance, if most of these GNF plans do have a foreign travel benefit, a $250 deductible for urgent and emergency with 80% coverage up to a $50,000 lifetime maximum. So that's something that they outline specifically that A and B doesn't cover. So unless it's outlined like that, if Medicare doesn't cover it, neither will your supplemental plan. Now, the grand finale today is talking about Part D standard design changes for 2026. This essentially affects everybody who gets their prescription drug coverage through a Medicare program. And whether you're getting your prescription drug coverage embedded in a Part C Medicare Advantage plan or you're buying it as a standalone policy, it's important to note that all the drug plans are following Medicare standard design to develop their benefits package. They're allowed to enhance Medicare standard design, but it never can be any worse than what Medicare offers. Medicare has phases to their drug plans and they change them every year. For 2026, phase 1 is the deductible phase. This is typically the amount of money you will pay at the drugstore before any of your drug coverage kicks in. The deductible for 2026 is going up to $615 per person for the year for calendar year 2026. However, depending on the plan you've chosen for your standalone drug plan or your Medicare Advantage plan, you may or may not have to pay this deductible going into next year. For instance, many of the Part C Medicare Advantage plans choose to waive the $615 deductible altogether, or they reduce it and only apply it to drugs on certain tiers, like maybe just the brand names. So that's something that could be an option for you in your plan coverage. If you have a standalone drug plan, most of the lower cost plans do have the deductible, or they at least apply it to brand name medications. To get a deductible waived on a Part D drug plan altogether, you're probably on a prescription drug plan that's well over $100 per month, depending on where you live. So that $615 deductible is always in the background, whether you're paying it yourself or your plan is helping you to meet it based on your needs. Now, phase 2 of standard design is what I kind of call the copay and coinsurance phase. So once that $615 deductible has been met or waived or what have you in the background, we all move on to the copay and coinsurance phase of our Part D program, whether it's a Part D standalone that we're pairing with original Medicare and our supplemental G or F, or it's embedded in a Part C Medicare Advantage plan. Now, every drug plan out there has a different list of medications that they cover. They may not all cover the same medications, and they may not cover them all on the same tier or at the same copay, coinsurance, or cost. So there's a great variety, and this is why you always want to make sure that you're checking your prescriptions each year against your plan to make sure that they remain competitive for you. Now, every drug plan out there, it's kind of difficult to find a drug plan that's a bad drug plan because every prescription drug plan out there is still Medicare Part D, and they're required to have at least 2 medications in every therapeutic class on their formulary. But because they put it on different tiers or apply it to a deductible or not, what can vary between plans is whether or not they have the exact brand name you need or what the copay, coinsurance, or deductible will be. So it is important to evaluate that. Now, prescription drug plans have tiers, typically tiers 1 through 5. Some plans have a tier 6, and any deductibles, copays, and coinsurances you pay go towards your max out of pocket for the calendar year. For next year, the max out of pocket for covered medications under Part D, it's $2,100. This year it was $2,000, so it's creeping up just a little bit for next year. Now, it's important to note that what goes towards the $2,100 is only included prescriptions. So if you're taking a medication that's not part of Part D or you're getting it from another source, it's not going to go towards your $2,100 max out of pocket. Or if you choose to take medications that did not get approved by your plan, it's not going towards your max out of pocket. So that's why it's important if you need something that's not covered by your plan, you work with your doctor to get an exception if possible. They call that prior authorization. So you want to make sure you're going through those rules and channels because if it's approved, it's going to go towards your max out of pocket ceiling of $2,100. If you reach that max out of pocket in a calendar year, you're going on to the catastrophic phase of Medicare Part D, which means you're going to pay $0 for the remainder of the year on covered medications. So really, really important. Keep in mind that every January it's going to start over based on the design for the following year under the Medicare Part D program. Now, there's some considerations for changes this year for your plans for Part C Medicare Advantage and Part D drug plans. One of the things to keep in mind is that Medicare rates the plans every single year on a star rating scale, a scale of 1 to 5, based on the plan's performance in various areas. The Part C Medicare Advantage plans have rankings from 0 or 1 to 5 across the country. The average rating is 3 out of 5 stars, and there's still plenty of plans out there that are 4, 4.5, or 5 out of 5 stars, depending on where you live. So some very well-rated plans under the Part C Advantage plans. For Part D standalone drug plans, they also get rated on a scale of 1 to 5, just for the drug components of the plan across the country. The average rating, again, is a 3 out of 5 star. Unfortunately, many of the drug plans are below the average rating going into 2026, and the highest rated plans are usually 3.5 out of 5 stars based on where you live. So star ratings play a role in the plan coverage because the higher the star rating, the higher the reimbursement rate these plans get from Medicare, and they can invest that into enhanced benefit designs for all of you. What we've seen this year is a combination of lower ratings on some plans and the fact that Medicare Part D benefits have improved this year and next year. And because of that, plans face some headwinds and they have to figure out how to cover those costs. So one of the things that we're seeing in the Part D standalone world and on some of the Medicare Part C Advantage plans is additions of premiums or increased premiums across the board on their plans. So you may have experienced something like this in your program going into 2026. We're also seeing some consolidation, particularly on Part D plans. So there's more limited options than we've seen in the past on standalone drug plans. And we've seen plans exit both on Part D and Part C Medicare Advantage. Depending on where you live, there may be more or less options than we've seen before, based on the fact that some of the plans have struggled to meet the criteria to provide a good benefit for you, or they can't remain competitive in the area. So they're exiting the marketplace. So we are seeing consolidations and exits, and that's something we need to keep our eye on as part of the evaluation as we help you moving forward. Another big trend that we're seeing on both Part C Medicare Advantage and standalone Part D drug plans is a higher share of cost, particularly on prescriptions in those early phases. To offset the $2,100 max out of pocket, more and more plans are incorporating at least some of or all of the $615 Part D deductible. And there's been a move more to co-insurance, particularly for Tier 3 medications that used to have a set copay. On Medicare Advantage Part C plans, the plans where you're using a set group of doctors and using just that private insurance company's card for all of your care, we are seeing some benefit reductions outside of the prescription drug space. Some of the plans are increasing their max out of pocket. If you're on a high rated plan, like a 4 out of 5 star plan or a 4.5 out of 5 star plan, we've seen minimal reductions and even improvements on those plans because they're getting higher revenue from Medicare that they can invest back into benefits for you. So that star rating plays a role on how competitive your plan can continue to be going into the new calendar year. We're also seeing on Part C Medicare Advantage plans some network impacts. So there are medical group partners out there and providers of care that can't afford to continue to contract with the private insurance companies for Medicare Advantage. And we're seeing some network disruption. So meaning some networks are no longer working with different private insurance companies at all, or are limiting the number of options that they work with. So that can have an impact to you and your care and could potentially mean that you need to consider a plan change to something that will incorporate your doctors. So there you have it, the 2026 Medicare update. I hope you found this helpful. If you did, throw me a like or put a comment on my YouTube. That would really help me and help get the word out to more people. If you haven't subscribed to my YouTube yet, I'm on a one-woman mission to get to 1,000 subscribers. I'm at 897, so technically 103 more subscribers that I need. All you need to do is take out your cell phone, open your camera, and hover it over this QR code. When you do that, it'll automatically bring up the link to my YouTube, and you can subscribe right there on your phone. You are really helping me grow when you do that, and you're helping spread this word of education out to everybody out there on Medicare. Thanks to all of you for sticking with me and for taking this opportunity to invest in your healthcare and learn more about what's going on for 2026.